a pickle, and they saw their stock price starting to plummet. So they brought, among the things they did was bring Ron Williams in, and Williams, among the first thing he did was order a revamp of the IT system, so that
the information technology
exactly, so that the company could determine more about which accounts were not profitable or marginally profitable. So with that new system, he was able, and the other executives, to identify the accounts that they wanted to get rid of. And over the course of very few years, they shed 8 million members.
8 million policyholders.
8 million people, men, women, and children, yes. Now, some of them were shed by intention. Some, I'm sure, probably walked because or left for whatever other reason, but they intentionally had this program to purge these accounts. And 8 million fewer people were enrolled in Aetna's plans. Many of them undoubtedly joining the ranks of the uninsured because their employers have been purged.
So what happened to Aetna's stock?
Went up. And
so did Ron's compensation, right?
Ron's compensation and his stock on Wall Street.
And so I think in the context of thinking about a government plan, what we say is, let's identify the problem we're trying to solve. Let's work collaboratively with physicians, hospitals, and other healthcare professionals, and make certain that we solve the problem as opposed to introduce a new competitor who has the rule-making ability that government would have.
You know, there's an irony because you hear the companies and their trade groups talking about how we don't want a public option that would put a bureaucrat between a patient and his doctor. But you've just described a situation in which a CEO is actually between a doctor and the patient.
It's true. And that same thing happened in the Nettoline Sarkeesian case. You had a corporate bureaucrat making a decision on coverage. So they are trying to make you worry and fear a government bureaucrat being between you and your doctor. What you have now is a corporate bureaucrat between you and your doctor.
Whose motive is profit.
Whose motive
understandably,
is profit.
naturally, is profit.
Right.
But companies, any company is in business to make a profit, right?
Oh, absolutely.
So how can you object? How can we object when an insurance company wants to increase its profits? That's a serious question. I mean, it sounds like a setup, but it's a serious question.
It's a very serious question, and I think that's people who are strong advocates of our healthcare system remaining as it is, as very much a free market healthcare system, fail to realize that we're really talking about human beings here, and it doesn't work as well as they would like it to. Yeah, there's nothing wrong, and I'm a capitalist as well. I think it's a wonderful thing that companies can make a profit. But when you do it in such a way that you are creating a situation in which these companies are adding to the number of people who are uninsured and creating a problem of the underinsured, then that's when we have a problem with it. At least I do.
This is the key question for me. Can health reform that includes a public plan actually rid our system of the financial incentive on the part of the insurance industry to provide less for more?
It will help. It would help. Would it rid it? No, I don't think it would, because of the for-profit structure that is now dominant in this country. But the public plan would do a lot to keep them honest, because it would have to offer a standard benefit plan. It would have to operate more efficiently, as does the Medicare program. It would be structured, I'm certain, on a level playing field, so that it wouldn't be unfair advantage to the private insurance companies. But because it could be administered more efficiently, then the private insurers would have to operate more efficiently, and that 20 cents in that medical loss ratio we talked about earlier might get narrower, and they don't want that.
As this debate unfolds in the next month into the fall, what should we be watching for? Tell us as an insider what to look for that is more than meets the eye.
Well, what happens is they will continue this charm offensive until there's actual legislative language. And what that means, of course, is that right now you're not really seeing the bills before the House and the Senate that will actually be voted on. When we see the actual legislation, when there's something before Congress, and it will happen presumably within the next few weeks, you'll start seeing a lot more criticism of it. And the special interests will be attacking this or that. the AMA will be upset about something, the pharmaceutical industry will be upset about something, the insurance industry will not like this or that. It's a lot of money is made in this country off of sick people, and then you'll start seeing a lot more of the behind-the-scenes attacks on these. On this legislation in an attempt to kill it. The status quo is what would work best for these industries.
In other words, if the industry is able to kill reform, or the Democrats and the Republicans can agree on a proposal, that's what the industry really wants.
Exactly, and it happened in '93 and '94, and just about every time there has been significant legislation before Congress, the industry has been able to kill it. Yeah, the status quo works for them. They don't like to have any regulation forced on them or laws forced on them. They don't want to have any competition from the federal government or any additional regulation from the federal government. They say they will accept it, but the behavior is that they will not, they'll not do anything after, say this plan fails, say nothing happens. They're saying now what they did in '93, '94. We think pre-existing conditions is a bad thing, for example. Let's watch and see if they really take the initiative to do anything constructive. I bet you won't see it. They didn't then.
Well, on the basis of the past performance and on the basis of your own experience in the industry, can we believe them when they say they will do these things voluntarily?
I don't think you can. I think that they implement things that make them more efficient and that enhance shareholder value. And if what they do contributes to that, maybe so. But they do say they are in favor of an individual mandate. They want us all to be insured.
For the government to require every one of us to have some policy.
Exactly, and that sounds great. And it is an important thing that everyone be enrolled in some kind of a benefit plan. They don't want a public plan. They want all the uninsured to have to be enrolled in a private insurance plan. They see those 50 million people as potentially 50 million new customers. So they're in favor of that. They see this as a way to essentially lock them into the system and ensure their profitability in the future. The strategy is as it was in 1993 and 94 to conduct this charm offensive on the surface, but behind the scenes to use front groups and third-party advocates and ideological allies and those on Capitol Hill who are aligned with him philosophically to do the dirty work, to demean and scare people about a government-run plan. Trying to make people not even remember that their Medicare program is a government-run plan that is operated a lot more efficiently. And also the people who are enrolled in our Medicare plan like it better. The satisfaction ratings are higher in our Medicare program, a government-run program, than in private insurance. But they don't want you to remember that or to know that, and they want to scare you into thinking that through the anecdotes they tell you, that any government-run system, particularly those in Canada and UK and France, that the people are very unhappy and that these people will have to wait in long lines to get care or wait a long time to get care. I'd like to take them down to Wise County. I'd like the president to come down to Wise County and see some real lines of Americans standing in line to get their care.
Wendell Potter, thank you very much for being with me on The Journal.
Thank you for inviting me.